Hello, good morning. I am about to tell you something that is going to sound impossible. Sometimes people actually get better when they come onto hospice. Hi, my name is Michelle Ledbetter. I am a registered nurse. I am hospice and palliative care certified, and I've worked in the nursing industry for over 30 years and in hospice for over 2 decades. And on this channel, we talk about life and death and any topic that comes up around that. So today, what I want to share with you is there have been many times in my career where I've actually discharged patients after they've been admitted. And the reason that happens is because when people come onto hospice, the physician will look at their medication profile and will look at the whole big picture. And medications that are being used for long-term effects, such as cholesterol medications, those medications will be considered for what we call deprescribing or coming off that prescription. So many times people come into hospice and they have what we call a polypharmacy. They have loads of medicines, 30 plus medicines. They come onto hospice and hospice does a real thorough overview of each medication and will decide and make recommendations to the family and the patient on which medications they feel that they can come off safely. And together, the family, the patient, and the hospice team will decide to start to de-prescribe certain medications. Now, as we have done that, what I have noticed is that patients will actually improve. What we see is the typical side effects of the multiple medications that they're on that causes fatigue or dizziness or nausea. Those things improve. The patient's gotten their pain under control because they are now here with hospice, and hospice is giving appropriate medications for pain management. People feel better, they start smiling, they engage more, and they can actually get to a point where they can go outside of the home. I've seen it too often to dismiss it. There is such thing as hospice graduation, and that's never a closed door. If your illness should exacerbate and we get back to a place where you are looking like you are exacerbated to the 6 month or less, based on the trajectory of your disease progression, you're eligible to come back onto hospice. But that is the way that people discharge off of hospice without actually leaving their physical form. Thank you so much for being here with me. If you have found the information that I'm providing helpful in reducing fear around end of life, or if it's helping you care for a loved one, or just understanding disease progression and how this whole thing works, I would so appreciate if you would share, like, and follow. If you can share, it will move my algorithm along and it will get information to more people, and it will help me to continue educating people about end of life. And that is truly my passion and my purpose. So I appreciate all my followers and subscribers, and I appreciate you for sharing. Until we meet again, remember to be kind to one another. And if you have a hospice graduation story,